How to cure erectile dysfunction, inflatable penile implant. As you can see on the left-hand side of the screen, the corpora cavernosa typically fill with blood. More volume equals more pressure equals rigidity. On the right-hand side of the screen, you can see the cylinders that are placed within the penile shaft similarly are filled by manually pumping the pump that's in the scrotum between the testicles, transfers saline from the reservoir into the cylinders, creating the same volume pressure inflation of the corpora.
Good afternoon, ladies and gentlemen. This is Dr. Jared J. Wallen, MD, board-certified urologic surgeon and men's sexual health specialist. Today we are talking about penile implant surgery as a cure for erectile dysfunction. It's common for men as we get older to have erectile dysfunction. In fact, upwards of 50% of men over the age of 40 may have some softening of their erections. Certainly things like pelvic surgery, smoking, Peyronie's disease, which is a scar tissue disorder of the penis, as well as diabetes can be very common risk factors for erectile dysfunction. And further, it can be common reasons why men may not respond to oral medical therapy for erectile dysfunction, such as Viagra, Cialis, etc. The penile implant is this device. This is a procedural surgery that's done as an outpatient in the hospital or surgery center setting. It's a 3-piece inflatable device that can be placed through a small little incision either above or below the penis. And essentially, once the surgery is performed and the patient is healed, the device is buried underneath the skin. You cannot see any of it. You may be able to see some indentation of the tubing or briefly see the outline of the pump in the scrotum, but otherwise, for the most part, in most situations, should not be seeing the device through the skin. It can be a very good long-term solution for erectile dysfunction as a cure. In fact, upwards of 90% or better patients are satisfied after they have this type of surgery. It turns out their partners are satisfied in high numbers as well, over 90%. And further, the longevity of this device, 60 to 80% of men are still functional 15 to 20 years after their original surgery. There can be minor things like a breakdown in this little tubing or mechanical malfunction of the pump or the mechanism within the pump, or some type of erosion of the tips through the skin with rough or vigorous sex, or certainly as we get older our tissues become less strong, and so that can cause some issues. But again, those are all less than 5% chance. Like I said earlier, upwards of 60 to 80% of men are still functional with this device 15 to 20 years later after their original implant. So how does this device work? It's basically 3 pieces. Again, there's 2 cylinders here. These cylinders are placed within the penile shaft that runs the entire length of the penis. Again, about half of your penis is external, about half of your penis is in the pelvis. And so what we do is we measure the entire length of that chamber and fit these cylinders into the maximum length that we possibly can fit inside of your native tissues. The second piece is the little scrotal pump that sits down in the scrotum between the testicles. We'll get to this a little bit later, but basically this is similar to the old pump on the Reebok shoes, where you would basically feel for it, grasp it underneath the skin, and pump to inflate the penile implant cylinders. The third piece is a little fluid reservoir. This little reservoir usually gets tucked in behind the abdominal layer fascia, or ultimately in by the bladder and the pelvis. And basically all it acts as is a reservoir for fluid to be held when the cylinders are deflated. You can see that these cylinders are inflated at this point, and ultimately you can see that there is some pretty decent rigidity to them, to the point where this actually potentially restores and delivers better than physiologic erectile function based on the strength of the rigidity of the device and also your normal tissues. So how does this work? Again, to some extent, the patient would grasp this little pump through the skin and squeeze, which transfers fluid from the little reservoir into the cylinders. You can see, again, this little button here on the pump actually is a release valve for the cylinders. And so what we'll do is we'll press that now and show you how to deflate the device. And so it's essentially a one-touch device where you push the button once, and that's now transferring the fluid back into the reservoir from the cylinders. At the end of this, it gets a little slow, so I'm just going to squeeze this a little bit here to expedite the end and show you the maximum deflation of the cylinders, which appear to be pretty significantly floppy and able to be hidden in your shorts and allow your penis to relax in its normal flaccid state. Now, obviously, the one thing with this is that there is some substance here that's not typically inside the penis, and so you may notice a little kink in the cylinder through your skin. That's very, very normal, but ultimately you should be able to kind of hide the penis back in the pants and be comfortable walking around with this device deflated. Again, how do we inflate? Well, we basically grasp the little device through the skin, and similar to the Reebok shoe, again, we basically pump. Every time we pump, that delivers fluid from the reservoir to the cylinders, and again, usually about somewhere between 10 and 12 pumps will deliver a fully inflated device. And so you can see as I'm pumping this, the cylinders are becoming more and more rigid and ultimately expanding in their girth, expanding in their width to perform similar functions as a normal physiologic erection. And ultimately we continue to pump until we can't really pump anymore. At some point this little pump gets difficult to squeeze because the cylinders are maxed out, which we're getting to that point now. Is very, very difficult to pump. And ultimately, again, you can see that these cylinders are pretty darn rigid to be able to participate in activities. How does that look like once the device is implanted into the patient? Well, that's what this model is for. This shows us what the typical situation is for after the device has been placed into the patient and what you can and cannot see. Typically, this procedure is done through a variety of incisions. One is called an infrapubic incision, which is just above the penis in the suprapubic or infrapubic region. One is called penoscrotal, which is done between the penis and scrotal junction and below the penis. And the third is called subcoronal, which is done essentially almost like a circumcising incision around the base of the head of the penis. And so again, here you can see there is some substance to this structure here, but the penile implant inside this is deflated. And so what I'm going to do now is that I'm going to grasp the little pump within the skin, and we're basically just going to squeeze, again, similar to what we would do with the Reebok shoe, just manually squeezing, allowing it to refill. It does take a few seconds for it to maximally refill. And so if you want to get the fewest pumps possible, then you would basically squeeze to the maximum, 1, 2, 3, 4, 5-ish, basically about 5 seconds for it to maximally refill. And then you squeeze again, wait a few more seconds, and keep squeezing again until the device is fully inflated. And you can see here, this device is becoming inflated. The penis is standing at attention with rigidity, and you can see, similar to normal physiologic function, there is rigidity. There is some more rigidity to the both horizontal and longitudinal aspects of the phallus. And so again, just a few more pumps for maximum rigidity, and you can see that the penis then stands at attention for activities. Again, at the end of activities, then you would grasp the pump through the skin, press the little deflate valve, and allow the penis to deflate in its standard flaccid, soft state.
Thank you for watching our video, How to Cure Erectile Dysfunction, Inflatable Penile Implants. This is Jared J. Wallen, MD, Board Certified Urologic Surgeon and Men's Sexual Health Specialist. Again, you can find us at www.mhurologytriad.org, as well as YouTube, Facebook, and Twitter. Have a great day!